Good afternoon, and thank you for coming. I want to give you an update on the latest on coronavirus effect on Philadelphia and its implications on what people in Philadelphia ought to be doing. So since our last briefing at 1 p.m. yesterday, we have 10 new cases of coronavirus infection confirmed and reported to the health department. That brings us to a total of 44. That number is less than the 16 that we reported yesterday. But don't anyone expect that number decline to continue. Based on everything else we are seeing, we expect that to increase. I'll come back to that in a minute. A little more details on the 44 people who have been reported so far. Of those, 23 were aged 20 to 39, 13 were aged 40 to 59, and 6 were aged 60 and higher. 8 of those were hospitalized, and of the 44, 20 were known to be healthcare workers. Now, not all of those healthcare workers were necessarily exposed at work. Some of them may have been exposed at conferences that they went to. But this does drive home that the people at greatest risk for an infection like this are healthcare workers, and the steps we need to take in order to protect the healthcare workers so that they are there for when we need them. So we are also following the developments of this infection and this epidemic in areas around us. And I've been struck by what's happening in New York City. For those of you who haven't seen this, on March 16th, so 3 days ago, they reported 196 cases. On March 17th, 459 cases, and then yesterday, approximately 900 cases. So they're doubling almost every day there. That rate of rise is likely to happen across the rest of the region as well. We're not that far from New York City. Now, some of that increase is just probably the increase in the availability of testing, so more people being tested, but we have to assume that most of that increase is real and reflective of increased transmission in the community. The numbers in Philadelphia that we're reporting may seem small, but remember that it takes about 10 to 12 days between when someone is exposed to this virus and when we ultimately have a positive test result. First, there's 4 to 6 days before they even show symptoms, and then there's time for us to get the test result back. So our numbers are really looking back in time about 10 to 12 days, and if they're doubling every day or two, you can imagine that things are probably far ahead of where we are now. In addition to that, we are seeing increases in the number of patients coming into hospital emergency departments with complaints of fever and respiratory symptoms. Now, we see this every year in Philadelphia in the annual flu season, but what we're seeing now is distinctly unusual. Some of this may represent people who have illnesses that during other times when they simply ride out at home rather than come to the hospital, but some of this is clearly real, and we assume that this represents people with this infection coming into hospital emergency departments. So with this data, we have to assume that this virus is spreading very rapidly through the city of Philadelphia. So I want to make sure people understand that. And up until now, for most people, this has been something that is very theoretical, something you see on television. This is about to get real. We expect that many people in Philadelphia will get this infection. With that in mind, I want to give people a sense of what infection actually looks like. The best study I can find that looked at the Diamond Princess cruise ship, where they tested everyone on the cruise ship and found out everyone who had an infection, and they looked at what their symptoms were, found that approximately 50% of people had no symptoms at all. And of people who have symptoms, data from China says that about 80% have mild or moderate degree of severity. 80% mild or moderate, 15% have severe illness, and 5% have critical illness. Now, the people with, are more likely to have severe illness are the elderly and people with chronic illnesses. So, with this infection spreading in the community, we expect that the majority of people will either not notice it or will have something that may feel like the flu that they can treat at home, but that they will get over. But some people are clearly going to need care. And so we want to preserve our healthcare system for the percentage of people that actually need it. I want to come back to that in a minute. Let me talk a little bit about the availability of testing now. More and more of the healthcare systems and healthcare providers in Philadelphia have set up testing sites. We now know of approximately 14 testing sites in the city of Philadelphia. By early next week, we expect that to expand to about 19. Yesterday, the testing sites that we know of collected samples on approximately 1,100 people, and that's up from about 700 the day before. Now, these sites are having a shortage of the test kits, the swabs that they use for taking the samples. That's called viral transport media. That's what they need to transport the sample to the laboratory. Because of that, they're not able to test everyone who is seeking a test. So each one of these sites has established criteria for who is appropriate to be tested. These are clinical criteria based on the expertise of the healthcare providers running those sites. So that means that not everyone who comes in requesting a test is going to get one. If you have symptoms of a fever and a dry cough and you want to have a test, contact your healthcare provider to find out whether your healthcare provider feels a test is appropriate. It may or may not be appropriate. If you have no symptoms, or if you have symptoms of some other sort of illness, don't get a test. Let's preserve the testing capability for the people who most need it. If you're young and healthy, you don't need a test right now. We want to save those test kits for others who need it more. Now, the Philadelphia Department of Health is working with partners at the state health department, other state partners, and federal partners on a testing site down in the stadium area. We hope to have that testing site open tomorrow afternoon. Hope to have it tomorrow afternoon. I cannot guarantee that. Like other testing sites, this site will have criteria for who they test. And the highest priority people for that testing site will be healthcare workers, the people who we all need to preserve our own health. Healthcare workers with symptoms. We don't want healthcare workers working with this infection because we don't want them to expose their patients. After that, we'll be able to serve people who are age 50 and above who have symptoms characteristic of this. There will be criteria at all times at this site. Those criteria may change over time, but that's how we're going to start. Again, I cannot guarantee that it will open tomorrow afternoon, but we are hopeful of that. A little bit about our healthcare system. Based on experiences around the world, we expect that there will be increases in demand for patients to see doctors in the emergency room and for beds. But remember that most people will not need medical care with this problem. If you are young and healthy with this illness and not having difficulty breathing, don't go to the emergency department. Save it so you're not exposing the healthcare workers there, and save it so that the few people who need emergency care can receive it. Stay home and rest. Keep away from others. Drink fluids and wait it out, just like you have the flu. But for everyone else, people who are not sick right now, some reminders. First of all, I want to thank those people who are heeding our messages to say, stay home. Stay home. Stay home. For those people who aren't heeding our messages, now is the time to stay home for sure. Everybody needs to stay home. It's the safest right now to assume that everyone that you come in contact with either already has the illness or may be incubating the illness. It may not be true, but assume that because the virus is clearly spreading in the community. Now, we will be having needs coming up here. As I said yesterday, but I want to repeat again today, the health department has an organization called the Medical Reserve Corps. This is an organization of healthcare providers and people who do not have healthcare training who can help out in a healthcare setting. If you want to volunteer for the Medical Reserve Corps, go to www.phila.gov/MRC and register. And if we have a need for your expertise, we will contact you and we will train you to help out. We need, again, both doctors and nurses, but also people who may be able to help out in a clinical setting who are not themselves doctors or nurses. If you want more information about the crisis overall, go to www.phila.gov/COVID. And if you have medical questions, you can contact our 800 number, 1-800-722-7112. Thank you very much.